Hi, my name is Joshua Kreitz. Here's my ID. Today we're going to be doing the medication administration checkoff. So first, let me just show you the room I'm in. All right. So first thing I would do when planning medication administration is I would always make sure I'm just in an area with no interruptions, making sure that all the doors are closed, never picking up my phone for any calls, limiting any communication with my colleagues unless it is very important, essential information, and always following the no interruption zone policy. And so next thing I'll do is I will just compare my patient care order form with the medication administration record. And so for a patient's name, we have Jaguar J. Jones, medical record number 4176352, 4176352. Allergies is penicillin, For our medication, we have morphine sulfate. The dose is 5 milligrams. The route is IM, intramuscular IM. Time is every 4 hours. And the indication is PRN pain. And all elements of a legal prescription are included. And so now I can set the order form off to the side because I'll mostly just be using this medication administration record. So now that I've done that, I will perform hand hygiene, and I will be able to move on to my first check of verifying the 7 rights of the medication administration. So first thing I'll do is I will, for the patient, verify the patient. So we have Jaguar J. Jones, medical record number 4176352. And so next I will verify the medication. So we have morphine sulfate. And so I'll look at the vial here, and it is also morphine sulfate. So the expiration date is 12/20/2025, so it is not expired yet, so it is good. Next is the dose, which is 5 milligrams. And so on our vial, it says 10 milligrams over 1 milliliter. So we would do our calculations and turn that into 0.5 milliliters. And anytime I do any calculations, I would always get another nurse to verify it for me. And so we would turn that into 0.5 milliliters. And for our route, it is IM. So for IM route, we would use a 3 milliliter syringe. We would use a blunt plastic cannula, and we would also use a 23 gauge 1-inch needle. And so first thing I would do for the dose is I would clean off my vial with an alcohol pad. So once I've done that, I will take my 3 milliliter syringe, not touching the tip. I will then take the cannula, the same thing, and I'll put that on there. And so I will look at that 1/2 line, and so that means that is 0.5 milliliters. And so I'll first fill it up with air at the line, take our cap off, making sure there are no air bubbles at all. Filling it to that 1/2 line. All right, perfect. Now we'll put the cap back on. So there, as you can see, we filled it to that 1/2 line. Pretty much that means it is 0.5 milliliters. That's what we got from our 5 milligrams. And so now what I will do is take off this cannula and put it into the sharp container, and I will put our 23 1-inch needle on with the safety cap on though. So now that once that is on, we can continue with our first check of verifying the 7 rights. And so for the time, it says every 4 hours. And so for Mr. Jones, it is required every 4 hours, and it has been 4 hours. And so it is time for more. And for indication is PRN pain. So that means Mr. Jones is in pain, and it is time for more medication. And so all elements of legal prescription are included. And so that is the end of our first check of verifying the 7 rights. And so now we can move on to the second check of verifying the 7 rights. And so first, obviously, we'll verify the right patient. And so we have Jaguar J. Jones with medical record number 4176352, and our right medication. So we have morphine sulfate, comparing it to our vial we used, which is morphine sulfate 10 milligrams over 1 milliliter, and that we turned that into 0.5 milliliters. That is in our syringe right now. And so and then our dose, like I said, 5 milligrams, we turned into 0.5 milliliters, which is in our syringe. And then the route is IM. And so just double checking our syringe we used and the needle. 3 milliliter syringe with the 23 gauge 1 inch needle is correct for IM injection. Time is every 4 hours. So it has been 4 hours. It is time for a new dose for Mr. Jones. And the indication is PRN pain. So our patient is in a lot of pain, so it is time for more medicine. And all elements of legal prescription are included. And so that concludes the second check of verifying the 7 rights. And so once I've done that, we will now be able to make a label for our syringe. So using this tape here, I'll use a Sharpie to write the patient's name, the medication, and the dose. And so I'll write Jaguar J. Jones, the medication, which is morphine sulfate, and the dose, which is 5 milligrams, but we turn that into 0.5 milliliters. So I'll write 5 milligrams dash 0.5 milliliters. And so that is everything that goes on to the label. And so I will now put that onto the syringe itself. And so that's what it should look like: the patient's name, the medication, and the dose. And so now that we have done that, we can now move on to, we're about to go into Mr. Jones's room. And so we can bring what we're going to bring. So we're going to bring the medication administration record form. We're going to bring the syringe and label itself, and we're going to also bring our vial. And so now we're just going to come over here. So as I walk into Mr. Jones's room, first thing I will always do is perform hand hygiene, and I will introduce myself, ask him how he's doing, and I will begin to start the third check of verifying the 7 rights. So first thing I'll do is I'll explain the procedure to him. I'll explain to him what we're doing. I will then I'll move his bed to a working height and lowering the bed rails to get into the comfortable position to work and do the procedure. And so then next I would verify the 7 things, starting with verifying the patient, but I will use the his armbands. So as we have here, the armbands and the allergy bands. And so verifying the right patient, I'll verify with his armbands, the MAR, and the label itself. And so we have Jaguar J. Jones, Jaguar J. Jones, Jaguar J. Jones, his medical record number 4176352, medical record number 4176352. Looking at his allergies, he has an allergy band that is allergic to penicillin, and on his MAR, it is penicillin. And then I would also ask him, Mr. Jones, is there anything else you're allergic to that you should tell me that we don't know of? And see if there's any of that, and then this is the time I would also pre-assess for anything necessary. And so next thing I would verify is the medication. And so looking at the MAR, we have morphine sulfate. Our label also is morphine sulfate compared to our vial, which is morphine sulfate. Looking at all three of them, it is correct. Dose is 5 milligrams. So we have 5 milligrams, which turned into 0.5 milliliters in our syringe. And so we will once again check our syringe, making sure it's at 0.5, and it is. Our route is IM, and so intramuscular. And so we will look at our syringe once again. So it's a 3 milliliter syringe with a 23 gauge 1-inch needle, which is correct for intramuscular route. And then for the time, it is every 4 hours. So it's been 4 hours. Mr. Jones is due for some more medication. And then for the indication, it is PRN pain. So Mr. Jones is in a lot of pain, so he is in need of medication. And all elements of legal prescription are included. And so now that we have completed our third check of verifying the rights, we can, what I'll do is I will perform hand hygiene. I'll put on my goggles and my gloves. And this is kind of the time where I will look at the skin itself. So since this is an IM injection, I would tell a patient we are going to be injecting at the ventrogluteal section of the body. So I would tell Mr. Jones to roll over so we can get to that area. I would assess the skin and the area we are going to inject, looking at the integrity of the muscle, looking for any bruising or anything like that. And so we do not see any of that right now. And so this is our patient, Mr. Jones. And so now what I will do is I will clean the area of injection itself with an alcohol pad. And so going in a circular motion, never going over the same spot again. And so now, since this is an IM, I would be going at a 90-degree angle, and so I will remove the cap, putting it into the container. I will separate the skin tightly, going at a 90-degree angle straight in, and then I will aspirate for any blood moving upward. I do not see any, so then we can slowly just push the medication. Putting that directly into there, and I will gently place my hand with an alcohol pad over where we injected. And so now what I will do is after this, I would make Mr. Jones comfortable again, put his bed at a comfortable height that he wants, put the side rails up, just making sure he's comfortable, and then I would remove my gloves. And I'm observing Mr. Jones, making sure nothing, he's not going into any reactions, watching for allergic reactions, making sure he's acting normal after I've given him the medication. And then I would then go document on the medication administration record. I would document how Mr. Jones handled the procedure, how it went. If there was any pain indicated by him, he would, verbally tell me that. And then I would document that, and I would then perform hand hygiene, obviously, after removing the gloves and all of that. And then once I've documented everything, I would come back to Mr. Jones's room about 15 minutes later to just assess him, make sure he's still doing okay, making sure that he has no reactions, no allergic reactions, nothing bad. And so that should conclude the medication administration checkoff. Thank you.